Go ahead. That'd be good.
Stethoscope. That's this one. Big word.
Here we go.
Nurse, yeah, moving up.
Okay.
I'm Kathy, and I'm a volunteer at Mary Trelia, and we're going to do a little series on health today, talking about some things that you might want to know when you go to the doctor or the clinic, and some common questions that we'll ask you when you're a patient. And you are? Tell me your name.
My name is
Yoon. Zoon? Okay. So when you come to the doctor's office or the clinic, you will get right at the desk, and they will say, what is your name? So you tell them your name. And they'll usually ask, what is your birthday? Do you know the date you were born?
my birthday January 18, 1960.
Okay, January 18th, 1960. And then they will put that in your record. Now, when you come to the hospital, we put bracelets on you. So you have a bracelet that says your name and your birthday and who your doctor is. And then they'll check that every time that we do something with you. They will look at that and see that you are the right person. And you'll have to tell them those things again. Now, another important thing we want to know is, do you have any allergies? Do you have any medicine that if you take it, you get rashy, itchy, sick? Do you? Do you know?
You're sorry, I don't know indeed.
Okay, so he doesn't know, so that's good to know. As far as we know, he doesn't have any, but he doesn't know. So we will just have to see how you do. Some people, if they eat certain foods or touch certain things like nuts or balloons, they get all itchy and they can't breathe very good. So that's important that the doctors and the nurses know that if you have a problem with any food or anything that you are exposed to. Then Ibu told you already, they usually get your weight and they see how tall you are. We're very big on numbers in America. Do you notice that? Your birthday, how much you weigh, how tall you are. We like numbers. So lots of times when you go to the doctor's office, they will want you to give a urine sample. So you just go in the bathroom and do what the nurse tells you about getting a urine sample. Because we can tell a lot of things. When you are sick, we can tell a lot from your body fluids, so they may take a sample of your blood. They might do the urine to see how that is. Plus, we touch you and see how you're feeling. We check your temperature, your blood pressure, so it gives us more information about what is going on with you. Okay, so a little urine cup. Now we have you in the chair, and we would check your blood pressure and your temperature. Okay, so this is the kind of temperature that we have. There's all different kinds. Sometimes they'll stick something in your ear. That's okay. That's the way we check a temperature. These are another way that we can use to check the temperature. We just slide this out of its cover, plastic, so no germs. And then, lift your tongue. There you go. Good. Now shut. Good. So that will beep when it's done and it'll tell us its temperature. Just rolling around. Slow. See what we got. Oh, you're cold. It's good you have your coat on. How is your blood pressure usually? Very good? No problem with your blood pressure? And they will feel a pulse here, and then we listen. And I think he has another layer. Yeah, he has more pulse. I don't know if I'll be able to hear. Really tight. And I heard 130/90. So we write that down. And they are putting all this in a computer or writing it down as we're getting the information. So they do both. So that is very good. Good. Okay. Then they might look on your mouth. Eva was talking about that when I came in. And we would say, why are you here? What is your problem? Something like that, to see why he is here. Now, he hurt his shoulder, right? Yeah, what happened? How did you hurt your shoulders? Scooping snow? Something. Cutting meat. Oh. So. Okay, so. Take a look in there. Oh, good. All right. And sometimes people gag. It's normal. Okay. Good. You know, let me look in and see. Okay, very good. Sometimes, when you have an injury, say I hurt my knee. Okay, maybe you hurt your knee. Yeah, now you have a hurt knee and a hurt shoulder. Oh, poor thing. See, this got wrong up backwards. Darn it. Nope, it's got two sides. To give it some support, okay? Kathy, what is that? What is it? Oh, it's called an ace wrap. It's stretchy, so you could use, if you could get it snug enough, maybe a dish towel if you didn't have one of these. But the doctor might give you one of these, or you can get this at Shopko or Walmart or any of those stores. Hy-Vee, I think, even has it. So it gives a little bit of support there. So if he had a strain, if he stretched too far, let's say he was scooping snow and his knee, oh, it just hurts. So he might put something like that on there, and it makes it feel better for a few days, and then it should be fine, and then take it off. Okay, sometimes you can put ice on. So this is just an ice pack, a little thing. You can use a Ziploc bag if you have at home. If you don't have an ice pack, just open it up, put the ice in there, fill it up, and then you just close it up again, and you could put that over there. That would feel good. This one ties on, so it's kind of nice for that. Sometimes, like his neck or shoulder, he might have put something like this around there too. Feels good. Some people like ice, some people like heat better, so it's whatever feels better to you. You can even alternate. Ice at first, when you first hurt it, is good, and then warmth after. So you could just warm, if you have a clothes dryer or a microwave, carefully, you could put a little towel or something in there and warm it up. A moist towel feels good, like you could take a dish towel and wet it a little bit and wring it out, and then just put it in the microwave, warm it up a little bit, and then put it right on there, and that might feel good. Warm bath, warm shower. So things that you have screenings, and I think Mary Trelly is going to have one here within the month or so. Come to that, and they will check your pulse, your blood pressure. I think they're going to offer all kinds of different health screening things. And that is good, because then you can keep aware of how your body is doing. Because sometimes people feel pretty good, and they have really high blood pressure. And you can have a lot of problems if you have a lot of high blood pressure for a long time and you don't know it, because you're feeling pretty good and you're doing everything you usually do, but it's a dangerous thing. So that sometimes is a problem, but we don't know it. So it's good to have that screening check when you have things.